Today is National Physician Suicide Awareness Day.
Yeah, physicians have the highest suicide rate of any profession. Didn't know that. And during this pandemic, the risk of burnout is even greater. Manhattan ER physician Dr. Lorna died by suicide during the height of the pandemic back in April. We are told in the span of just 3 weeks, she treated patients with COVID-19, contracted the virus herself, recovered, and went back to work. She and her colleagues worked around the clock trying to save people's lives, and in many cases, the emotional toll on physicians is, of course, devastating. And joining us live this morning is Corey Feist. He's the brother-in-law of the late Dr. Lorna, and Dr. Gary Price, president of the Physicians Foundation. Good morning to the both of you, and thanks a lot for joining us.
Good morning.
Good morning.
Thank you for having us.
Of course, and Corey, of course, we offer our condolences to you. Sorry to hear about your loss. Our prayers are with you and your family. A question for you: why does this crisis often go overlooked by families and the physicians themselves?
Thank you for the question, and thanks for having us today. This culture that pervades both our society, where we don't really talk about mental illness, it's still a stigma, plus the culture within the medical community, which does not look to admitting fatigue or asking for help as courageous, but rather a sign of weakness, is really the root cause of why we're here today to talk to you.
And we're so glad you're shining a light on something that people often hide. And this question's for you, Dr. Price. Why has burnout been such an issue with physicians, and how has the pandemic made it even worse?
Well, that's a great question, and we knew prior to the pandemic that we were already facing an epidemic of physician burnout. Prior to 2020, our surveys showed that at least 40% of physicians were reporting symptoms of burnout. We're releasing a survey today that has revealed the fact that that number is now up to 58% since the onset of the pandemic. Of course, being a physician has always been stressful, and there have been a number of pressures on physicians, including increasing regulatory burdens, having decision-making taken out of the hands of physicians and patients, and sometimes not even having the resources to treat patients properly. The pandemic has made what was a really bad situation much, much worse.
It has. Dr. Price, with that said, how is the Physicians Foundation helping support physicians in need?
The Physicians Foundation this year has launched a program called Vital Signs, and that program's designed to, number one, raise awareness of the problem of burnout and physician suicide, but then to go beyond that and to give physicians, their families, loved ones, and colleagues practical tools to start the conversation and to recognize burnout so that we can begin to heal this very serious problem.
And this question's for Corey. Can you tell us more about the foundation you helped to create in honor of your sister-in-law, Dr. Breen?
Absolutely. My wife Jennifer and I founded the Dr. Lorna Breen Heroes Foundation to do two primary things. One we're doing today with you, which is to build awareness for these issues and really shine a light on the stigma of mental health so that healthcare providers can get the support they need. Second, we're funding programs that are hopefully going to reduce healthcare professional burnout and improve their well-being. All that, and today we've launched Stand with Lorna as a hashtag in honor of Lorna and all of those healthcare heroes who we've lost along the way.
And I guess the final question is for Dr. Price. Where can physicians and their loved ones go for help?
They can go to our website, physiciansvitalsigns.com, and that has helpful tools in both recognizing the symptoms of burnout, our acronym HEART, H-E-A-R-T, to help remember what those signs are, and very practical advice on beginning the conversation and helping a physician begin to work on resolving burnout.
All right, Dr. Price, Corey, thank you so much for joining us. It is so good what you guys are doing and trying to help physicians, not just here in our country, but across the entire world. And Corey, my prayers are personally with you and your entire family. Thanks for being with us.
Thank you so much.
Thank you.
Goodbye.
Thank you.